Chapter 25, Treatment of Thyroid Disorders. We'll skip through the key terms and cover them throughout the chapter. Thyroid disease is up to 8 times more common in women than in men. Hyperthyroidism is most common in women between the ages of 20 and 40 years. The thyroid gland secretes hormones that have an effect on almost all cells in the body. The thyroid hormones T4 and T3 regulate growth and metabolism. Box 25.1 shows us physiologic actions of thyroid hormones. So they're responsible for the growth of skeletal tissues, fetal growth and development of the central nervous system, circulatory volume, bone turnover, respiratory function. So that's important for a lot of things in our body. Thyroid levels are tightly controlled by a negative feedback loop. When the need for thyroid hormones increases, the hypothalamus secretes thyroid releasing factor, a hormone that signals the pituitary to release thyroid stimulating hormone. The target site of TSH is the thyroid gland, which produces and secretes T4 and T3. Once desired levels are achieved, TSH release is turned off. The thyroid gland is one of the few glands that produces and stores its hormones. The TSH test measures the level of TSH in the blood. A low TSH level signals hyperthyroidism. This is to be expected because TSH release is turned off when the body recognizes that T4 levels are high. The body therefore attempts to stop its further production and release. A high TSH level is a signal for hypothyroidism. The TSH test measures a level of TSH in the blood. A low TSH level signals hyperthyroidism. This is to be expected because TSH release is turned off when the body recognizes that T4 levels are high. The body therefore attempts to stop its further production and release. A high TSH level is a signal for hypothyroidism. And the presence of thyroid stimulating antibodies can be measured by a thyroid antibody test. When thyroid antibodies are present, autoimmune thyroid disease is diagnosed. A radioiodine uptake test may also be conducted to test for thyroid diseases. Iodine is selectively taken up by the thyroid gland in the process of synthesizing T4 and T3. Thus, when a low dose of radioactive iodine is administered, the amount of radioactivity in the thyroid gland can be measured. Hyperthyroidism is a condition in which the thyroid gland secretes excessive amounts of thyroid hormones. The following conditions are known to cause hyperthyroidism: thyroid nodules, so lumps on the thyroid gland that secrete thyroid hormone, and inflammation of the thyroid gland, like subacute thyroiditis, postpartum thyroiditis, and lymphatic thyroiditis. Graves' disease is an autoimmune disease and a primary cause of thyroid hyperactivity. Graves' disease is the primary cause of hyperthyroidism. When it is left untreated, the severe hyperthyroidism that results may lead to cardiovascular disease and death. Potassium iodine can protect the thyroid gland against exposure to radioactive iodine. Box 25.2 shows us symptoms of hyperthyroidism: rapid heart rate and palpitations, muscle wasting, weakness, weight loss, shortness of breath, restlessness, sleeplessness, sweating, rapid speech. Treatment of hyperthyroidism involves the administration of either anti-thyroid drugs or radioactive iodine. It can also be treated with surgery. Low dose radioactive iodine is used for diagnosis, and higher dose radioactive iodine is administered for the treatment of hyperthyroidism. Radioactive iodine is made in a nuclear pharmacy and is regulated by the Nuclear Regulatory Commission. Radioactive iodine therapy is contraindicated in pregnant women because the drug can cross the placenta and can cause thyroid damage in the developing fetus. Propyliothia Uracil, PTU, or methimazole are anti-thyroid drugs. They are used for the primary treatment of hyperthyroidism or to reduce excess thyroid hormone levels in patients awaiting treatment with radioactive iodine or thyroid surgery. PTU and thymazole block the synthesis of T4 and T3 by blocking the enzyme that catalyzes the coupling of iodinated tyrosine. PTU is also capable of blocking the conversion of T4 to T3. The maximal benefit of PTU therapy is not achieved until all to the thyroid hormone that is stored in the thyroid gland follicles is depleted. This can take about 2 to 4 months of therapy. Methimazole and PTU may also produce a dangerous decrease in the number of white blood cells, which increases the risk of serious infections. Like radioactive thyroid therapy, treatment with anti-thyroid drugs typically induces hypothyroidism. Hypothyroidism is a condition in which the thyroid gland secretes deficient amounts of thyroid hormones. Hashimoto's disease is an autoimmune disorder in which the body produces antibodies to its own thyroid cells. The antibodies in white blood cells attack and damage the thyroid. Hashimoto's disease is the most common cause of non-iodine deficiency hypothyroidism. Box 25.3 shows us the symptoms of hypothyroidism. So extreme fatigue, weight gain, dry skin and dry coarse hair, poor memory, constipation, enlarged heart, depression for some of them. Just a little note, levothyroxine is the replacement for naturally occurring thyroxine. Thyroid replacement therapy is the principal treatment for hypothyroidism. Replacement can be achieved by the administration of desiccated whole gland animal thyroid or synthetic T4, synthetic T3, or a combination of the two hormones. The most widely prescribed treatment for hypothyroidism is synthetic T4, which is converted in the body to T3. Bioavailability issues exist between different manufacturers' formulations of synthetic and naturally occurring thyroid preparations. Numerous medications interact with thyroid hormones, ferrous products, calcium supplements, cholesterol lowering agents, and didanosine interfere with absorption of the thyroid hormones. Food delays absorption. Anti-seizure medicines such as phenytoin and carbamazepine accelerate the rate of metabolism and of thyroid hormones. 25.4, medications that interact with thyroid hormones. So you can see that list there. One interesting thing, the various strengths of levothyroxine are color-coded to help avoid dispensing errors. They have quite a bit of strength. So you can see right here. And those are all the different strengths that the tablet comes in, and they're all differently color-coded. That we have quite a few brand names for levothyroxine: Levoxyl, Levo-T, Synthroid, Tyrosint, and Unithroid. The capsules are the Tyrosint only. There's a powder for injection. And then liothyroid, which is the T3. It's available as a tablet under Cytomel and as an injection solution, Triostat. Liotrix, which is a medication with T4 and T3. You can see all of the different dosage strengths. So it's levothyroxine and liothyronine combined. Then for desiccated thyroid, we have the 30, 60, and 125 milligram tablet. All right, so now we're looking at the summary of drugs used in the treatment of thyroid disorders. For hyperthyroidism, for methimazole, we should avoid pregnancy. Hypothyroidism, for levothyroxine, we want to avoid antacids, dairy, calcium, and iron pills within 4 hours of dose. We should take on an empty stomach and take with a full glass of water, and we should not skip doses.